Good morning, students. Now let's start our consultation on basics of neurology. And first of all, I want to show you exam question list. And here we have anatomy questions, and on your final exam of basics of neurology you will have 3 questions. One is from anatomy, one is from histology, and the last one is from physiology. And I just want to focus on our physiology questions here. We give you some exam list, but this list, it doesn't really looks like questions. It looks like just description. So we said physiological effects of adenohypophysis hormones. So on the final exam we will ask some questions about this. For example, we will ask questions about adenohypophysis, another name of adenohypophysis, or the hormones which is released from adenohypophysis. And again we will ask you the physiological effects of write the physiological effects of adenohypophysis hormones. So now we have some sample questions, sample tasks. Let's see. And here we have a notification. It said, dear students, on the final examination of our basics of neurology, you will solve some situational tasks. Be careful when you're answering these questions, and you must write clear and exact specific answers to the given questions and explain the mechanism of processes. Let's see. Here we give one task. It said task number 1, and here we just give you one figure, and here we have someone is standing here, and questions. Let's look at the question. So this is your task, and questions is here. So our questions is, what is the name of this disease shown in the figure? So you just need to give name of this disease, and then we ask the names of hormones which can cause these changes in the body. Then where is this hormone produced? And then question number 4 is, write the functions of this hormone. And question number 5, it is obviously about mechanism. So regulation mechanism of these hormones. Let's see. We have some sample answers. So the answer of first questions on the final exam, you just need to write the exact answer. So on the final exam you just need to write answer like this. So what is the name of this disease? So you just question number 1. So answer number 1 is the pituitary. This is called, you can write, this is called pituitary gigantism. So and you just say pituitary gigantism, it's acceptable. So number 1. So what names hormone which can cause these changes in the body? It is growth hormone. It's growth hormone. You just need to write growth hormone. And sometimes we call it somatotropic hormones, sometimes we call it somatotropins. So all 3 answers are acceptable. And we said, where is this hormone produced? It means you just need to write some places. So it's adenohypophysis. So you can just write adenohypophysis, and you can write growth hormone is produced in the adenohypophysis. And I give one more answer like this because I think this answer is the most acceptable answer. So you need to write growth hormone is secreted by somatotropes, which are acidophilic cells, also anterior pituitary. So don't worry about it. If you just write adenohypophysis, it's acceptable. You will not lose any marks because of that. And let's see, question number 4. It said, write the functions of this hormone. So you just need to write the functions of growth hormone. So in here we said it is in children and adolescents as well as in the teenagers with not epiphyseal fusion bones. It causes obvious acceleration of linear growth, mainly due to the growth of long tubular bones of the extremities. And again, it will enhance protein synthesis and inhibit its decomposition. It also reduces the deposition of subcutaneous fats, and it enhances fat burning. And again, it will cause significant increase in the blood sugar level. And it is an counter-insular hormones, insulin antagonist of its effect on the carbohydrate metabolism. It's also known for effect of pancreatic islet cells, and again it has a function of immune stimulating effect, a kind of this one. And again explains the regulation mechanism, and here we just see it's regulated by hypothalamic releasing factor. Again, it can also be regulated by negative feedback system. And we said hypothalamic releasing factors, we have one somatostatin, and its English name is growth hormone releasing hormone, and you have somatostatin. Its English name is growth hormone inhibitory hormone. So and this you said growth hormone inhibitory hormone will inhibit the production of GH, and somatostatin, it will cause increase the synthesis of growth hormone, so it will increase the GH production. Again, let's see task number 2. In the experiment, the posterior lobe of pituitary gland was removed. So this is just given. This is a case. And question, what is the name of posterior lobe of pituitary gland? So kind of this one, what is another name of posterior lobe of pituitary gland? And it is neurohypophyse. You just need to write neurohypophyse. And again, we second question, it said list and write the posterior pituitary gland. List and write the posterior pituitary gland hormones. Actually, here is mistake. So list and write the posterior pituitary gland hormones. So you just need to write the hormones which belongs to posterior pituitary, and we know we have only 2 hormones belongs to posterior pituitary gland. It's oxytocin and ADH. And here second question, second answer is you just need to write ADH and oxytocin. And again, question number 3, it's relating to question number 2. We are asking the functions or the physiological effects of these hormones. So you just need to describe the functions of oxytocin and the ADH. And here is our just simple and clear answer. So we said it regulates uterine contraction, and again it causes uterine contraction, and it will cause ejection of milk. It can cause milk letdown from the mammary glands, but it will not affect milk synthesis. And this we said it will determine some maternal behavior. And ADH, it's more the main function is retention of water in the kidney nephron. So it helps concentrate and reduce the final urine volume. And again, it has another function to increase blood pressure by cause myocardial cell contractions and narrowing of arteries. And again, it said it has another function. It said it will stimulate the secretion of ACTH during stress. And it said forming the motivation for thirst and drinking behavior. And question number 4, we asked where are these hormones produced. So where are oxytocin and ADH is produced. So they are synthesized in the supraoptic and the paraventricular nucleus of the hypothalamus. So they are synthesized in the hypothalamus and transported to the neurohypophysis by the nerve fibers of the hypothalamo-hypophyseal tract and by means of axonic flow and released into the blood blood of the capillary of the interior hypophyseal artery. And question task number 3, it's about CNS, and you notice if you notice the task number 1 and the number 2 is relating to our endocrine system. So task number 3, and this is the case, this is given case. So at the doctor's appointment, the patient M, he is 43 years old, and he complained of unsteady gait, deviation from a straight line when walking, and examination revealed a violation of motor coordination, mismatched work of individual muscles or muscle groups, weakening of motor reflexes. And the question, we have 3 questions, and pay attention. During our physiological question, basics of neurology, about physiological part, we will have questions of 3 to 5, up to 5 questions will come. And again, in this case, question number 1, in this case, what structure of central nervous system dysfunctions is observed? And and again, we don't need this one actually. Some mistakes occurred. So what structure of the central nervous system dysfunction is observed in this case? So, and again, question number 2, list the main functions of these structures. And because we think one structure of central nervous system is have dysfunctions, and we are asking first, you must name this structure, and it said it's a disorder of cerebellar functions, so cerebellar dysfunction. So the cerebellum has some problems. So first you must name this structure, then you must explain its functions. So the function of cerebellum, it's adjust posture and muscle tension, correct slow and purposeful movements and their coordination with maintaining postural reflexes. And it said correctly execute fast purposeful movement according to the commands which is from the cerebral cortex in the general movement of program, and again it will participate in some adjustment of autonomic functions. And question number 3, when this structure is damaged or removed, what violation do you know, and what are their names? And we asked you to use some medical terminology. So the answer will be like this. So after damaging cerebellum, the following main symptoms can be observed. So we list 5 symptoms. So symptom number 1 is Luciani triad. It's asthenia, atonia, and astasia. We have a Charot's triad, and nystagmus, intention tremor, and stacco speech. So we have ataxia, dysmetria, dysarthria. So, and again we explain these symptoms. We use some simple and understandable words. So ataxia is lack of voluntary coordination of muscle movement, and the dysmetria is lack of coordination of movement that undershoot or outshoot of intended position. And the dysarthria, it's a motor speech disorder of organization. And question task number 2 Again, it's about central nervous system. Here we give the description. It said during the examination, the doctor invited the patient to a special room isolated from the light and again sound. The patient wears a special cap with electrodes on his head, and he sits in the comfortable chair. And question, and we gave one figure here. It's a clue. So question number 1. In this case, what kind of examination is carried out by the doctor? So you just find out what kind of examination is carried. So obvious, it's he wears a cap and it has some electrodes, and this cap is weighed on his head, and he has comfortable seat, and it means we are detecting his EEG, it's electroencephalography. Then we are asking you to give definition of EEG. So we give some simple definition. Instead, it's a method of checking the electrical activity of brain by placing electrodes on specific areas on the surface of head. And again, third one, we are asking you to determine the rhythm and write down its characteristics, and we are asking you its frequency, amplitude, and its some states, functional states of the registered body. And you know, EEG, we have 4 rhythm: alpha, beta 1, delta, and the theta rhythm. So alpha rhythm, its frequency is 8 to 13, its amplitude is 50 to 100 microvolt, and again beta is 13 to 20. So you must write it like exactly like this, and you must say some state, functional state, when we registrating alpha rhythm. So if we registrated alpha rhythm, it means rest of we have rest subjects. We have subject which in a dark room with eyes closed but did not sleep, and it is best defined in the occipital region, and said it will be blocked or disappeared during mental activity or visual attention. So you need to describe its significance, each one. And again, task number 5, the description is said 2 different aged people was tested for visual functions. If you know, this question is about analyzer. Let's see, 2 different aged people was tested for visual functions. When determining the near point of clear vision, the following results were gotten. So first person's near point is 12 centimeters, and second person's is 30 centimeters. So question number 1, what is the near point of clear vision? So this question is about visual analyzer. So you must give definition of near point. So here we just said near point of clear vision is, you can give your definition. So I will say the near point of visual clear vision is it's a point nearest the eye at which an object can be placed and still have a clear and sharp image produced on the retina. This is my definition. And for normal person, we said it could be 25 centimeters, but it differs by age. So young people it will be less, and older people it will be more. So it could be tested by which method, and I can say it will be tested by push-up methods, and you can write your methods. Maybe this one is determined by some different or various methods in different country or in different clinical. So, and how can we test? I said we can test by push-up test. So question number 3, which of these people is older? And I told you the younger the people, it will be short. Yeah, it will be short. So the second person is older with age, and the elasticity, because the reason, the elasticity of lens gradually decreases, which led to a physiological weakening of the volume of absolute accommodation. As a result, the near point of clear vision moved far from the eye. So second person is older than the first one. So how old are they approximately? And so the first one, we assume the first one is 25 years old, and second one, it's approximately 30 to 40 years old, but and here we write 40 years old. And here the question looks like this, but in the visual analyzer, if you noticed, here, defects, some abnormalities of visual analyzer and visual functions, and we have some methods for determinations. If you study some methods for determinations for visual analyzer and its part, and its significance about retina, blind and yellow spot and near point, you will know how to answer these questions. So next one, the patient was conducted a study of visual function. When investigating visual fields of patients, following diagram was obtained as a result. So this diagram is obtained. So is again give definition of visual field. You must answer the visual field. So you can I will say visual fields is the portion of space which is portion of space in which objects are visible at the same moment during steady fixation of gaze in one direction. So it has boundaries. So we are asking the normal visual fields, boundaries of normal visual fields. Inner, it means nasal, outer, temporal, upper, superior, lower, inferior. So here we said inner is 60 degrees and outer is 90 degrees. It's most extended. And upper one is 60 again, lower one will be 70 to 75. And the peripheral visual field for extent, it will extend 100 degrees laterally, 60 degrees medially, and 60 degrees upward, and 75 degrees downward. So it will be same as this one. So, and which method is used to test the visual field? You know, it will be tested by our it will be tested, or it will be examined by perimeter, and we have a special perimeter. It's called Forrester perimeter. And question number 4, it's about this figure. So which part of this patient's visual pathway is damaged? And you will show the number, you will write the number. So if you need to answer these questions, you must know the visual pathway. So when the light passes through the lens, it reaches the retina, and where the formed image is inverted and reversed. So for example, upper visual space information will be projected to the lower retina, and axons leave the retina into the optic nerve, and fibers, pay attention, fibers passes through the optic chiasm, and subsequently in the optic tract, and there is fibers crossing in the optic chiasm, and in neural fibers from the left side retina, neural fibers of the left side of the retina will end up in the left optic tract. Pay attention. So neural fibers from the left side of the retina, left side of the retina will be end up in the left optic tract. And again, neural fibers from the right hemiretina will end up in the right optic tract. And that's why here our right eye is blind, fully blind. So it means our right optic nerve is has damaged. It has some damage, has some problem here. And next one, it's about higher nerves activities. And here our cases. Two young fellows came to another city or new city and entered a medical institute. And the first one quickly got used to it, and the next one became sad and started to sleep badly and didn't want to go to lesson. The questions: how would you explain the different reactions of students in the same situations? So they have same situations, but two students have two different reactions. It's because you need to answer. The different reactions of students are explained by different mobility of nervous process, and sometimes mobility is explained by activity. So different mobility or different activity of nervous process. So what is the mobility or activity of neural process in the first students? So in the first students, it has high mobility. It is very high. So a new dynamic stereotype was developed quickly, and it means he is quickly adapt to new environment. The training of future proportion matches with his interest, as a result of which positive emotions contribute to a faster adaptation. And about second students, its mobility is very low, and here we say its mobility is very poor. So it's very slow to break the fixed dynamic stereotype to develop a new dynamic stereotype. In addition, the sciences or the subjects learned did not arouse the students' interest, and they created a negative emotional attitude of him. And question number 4, what is dynamic stereotype? Give definition. So a dynamic stereotype is a stable sequence of a set of conditioned reflexes which are developed as a result of repeated exposure to a set of conditioned stimuli in a specific order and combined with the performance of specific tasks. And the next one, task number 8, it's again about higher nerves activity. So when starting to study first experiments on conditioned reflex, Pavlov built towers of silence with an absolutely soundproof laboratory. However, it was later discovered that dogs in these cells became fall asleep in such cells. So they became sleepy, and this happened especially quickly with the sanguine dogs. So question: why did dogs fall asleep? So the reason is, for normal functioning of brain, a constant influx of external stimuli is needed. The monotony of stimuli will reduce the tone of cerebral cortex. Sharp restriction of afferent impulses reduces the tones of cortical neuron. That's why the dogs become asleep. And again, question number 2, why did this happen, especially quickly with sanguine animals? So sanguine animals, or sanguine people and people animals most needed external stimulation, and these animals are particularly sensitive to lack of afferent influx of stimulation, and it's to stay active state they need a constant influx of information. If this information is blocked, they will not be active. That's why they become sleepy. And again, question number 3, what is the basics for classification of types of higher nervous activity according to Pavlov? Pavlov based on 3 main bases. So it's strength of stimuli, and the balance of stimuli, and the mobility of stimuli. And that's all. So this is our consultation, and here our questions and questions, and you need to focus on these questions. But during examination we will ask you questions about from cases, but the question is exactly from these lists. And pay attention, these shown 8 cases will not come to our final examination. So thank you, have a good day, wish you have good examination, wish you have good results. Bye.